Hi there, I'm Rachel from Freedom Physical Therapy in Grafton, and I wanted to talk a little bit more about exercises that I give for people that are experiencing sciatica type symptoms. I first made a video a little bit about neuroflossing, and now I just wanted to take it to a little bit simpler of a level and just demonstrate 2 stretches that I will often give. Again, like I emphasized in the first video, if there is any increased pain or anything with these exercises, you should not continue them, of course. Like I said, there are many different reasons you could be experiencing sciatica, and so sometimes these are given for some of my patients that have true sciatica, but sometimes they're not going to be beneficial or useful, so it's important to know the true cause. So the first is a figure 4 hip stretch. So this is a pretty straightforward, pretty simple exercise. The goal is to really stretch a little bit of the glutes out with this one, hopefully loosen the muscles up a little bit, take a little pressure off that sciatic nerve if that's something that's causing increased pressure on your nerve. So again, up nice and tall, you're going to take your ankle, cross it over to your opposite knee. So if I'm experiencing the symptoms on my right side, that's the leg I want to lift up and cross over. So up nice and tall, and then you're just going to hinge forward at the hips just a little bit. You should start to feel some tension through kind of your right hip and glute area, a little bit of a stretch. That is all good. There should be no increased pain. You shouldn't come out or into the stretch and say, oh, have any issues with numbness or tingling in your leg. We don't want to cause numbness and tingling, but you can push into it a little bit, and if you're doing the stretch and saying, okay, I'm starting to feel a little bit of a tingle, you go ahead and then stop. That's enough. You don't want to overstretch or irritate the nerve, but you do want to stretch out a little bit. So usually I'll say about 30 to 45 seconds per side per stretch. Usually 2 to 3 times a day is plenty. I always am a fan of stretching after activity. So you can stretch just sitting at a desk. That's okay. I've told people they can do that. But it would be nice if you did some sort of activity, if you were walking around, went for a walk, or doing a little bit of cleaning, so your muscles were just a little bit warmed up, and then you stretched. But again, any questions, concerns with that, please let me know. The second stretch is a very simple, straightforward hamstring stretch. A lot of times people have a ton of tension through their hamstrings and glutes. So the first one's through the glutes, this is for hamstrings. So again, up nice and tall. You can't see the bottom of my leg, but it is nice and straight. That leg is fully straight. My ankle is just in a neutral position. You don't have to extend it. And then all I do is unlock my leg a little bit. I don't want it to be locked straight. I want a slight bend in that knee, up nice and tall, and just hinge forward at the hips, and you should feel a nice pull down the back of your thigh. That is your hamstring stretching. Same thing, 30 to 45 seconds, switch sides, same thing, 2 to 3 times a day. Let me know if you have any questions, concerns, contact your physical therapist. Thank you.